Um, where we were is that this new kind of mandated role for our sector means that, unlike the things that aren't changing that I mentioned on the slide before, what is changing is that as a sector, we will have a voice at system-wide governance and decision-making for our integrated care system. And that has been supported with development from NHS England to develop a VCSE alliance in each of the 42 ICS areas that I mentioned. So 19 of them received support a few years ago, and they've got 1 to 2 years on us. 23 ICSs, which includes the Hampshire and Isle of Wight ICS, and also Frimley, which for Hampshire colleagues, you might also find that some of your work crosses into Frimley ICS as well. That's an interesting geography. We're in the newer patch. We've had support over the past year, so we're newly emerging. This is another video that I'd encourage you to watch, included in the slides. It shows one of those areas that's had a bit longer than us to develop, the Northeast and North Cumbria, which is actually a system that we've looked at quite closely and have kind of borrowed some of their early thinking, because they cover a very large geographic patch like we have in Hampshire and the Isle of Wight. And so this is a useful video that talks a bit more about kind of what the role of a VCSE alliance would be in the integrated care system. So do have a look at that on your own time as well when you get the slides. So just to kind of emphasize that as a sector, we can have a really important role in the new integrated care system. We can support the integrated care system to deliver integrated care. We can get involved in systems, strategic, workforce, and operational planning so that we can shape and improve the delivering of services and develop plans to tackle the wider determinants of health. So often at the moment, the role the sector has, it comes at the point of delivery. And we're a really key part of that, but actually being involved in the system-wide elements of the integrated care system give us the opportunity together to have a role much earlier than the point of delivery, which means that we can shape what ends up, what gets commissioned and what decisions are made and how situations are handled. So part of this process have been kind of making the case for VCSE representation. So these are some of the points that, as we've been doing this work over the past year, we've put together in terms of why the sector should be represented at system-wide level. These are the points we're putting together for our ICS colleagues. So just again, why we get involved, we have expertise as delivery partners and as organizations embedded in our communities. We have expertise in prevention, in early intervention, in what community needs are. We are innovative and cost-effective and also often holistic. And we already provide integrated services. And we have a huge amount of insight about our communities, the ones that we support, which could be, made much better use of if we were more plugged in. So as I mentioned, we have neighborhood, place, and system, and there's lots of existing ways that we're already involved at neighborhood and place level, whether it be social prescribing or representation at health and wellbeing boards, and sometimes getting to co-design certain projects. But getting involved in the system means we also are going to have a role in governance and system transformation, long-term planning, scaling good practice, and so on. So that all brings me to HIVCA. This is the process we've been going through over the last year. The NHS England nationally provided support to each ICS area to develop some sort of VCSE alliance or to support one if one already existed. We didn't have one. We didn't have an alliance of organizations that cuts across Hampshire, Portsmouth, Southampton, and the Isle of Wight. And so we've created one collaboratively And many of you on the call have been part of that, but also some of you haven't and you're hearing about HIVCA for the first time. So these few slides are a bit about the path we've taken. Action Hampshire is a convener for this process, as I mentioned, and that's why I'm talking about this with you today. So just a few steps back, the sector had been talking with the CCG board about a new way of working with the VCSE sector for some time before this was actually brought in and the support was provided to develop the alliance. So it has been coming in along the works, and broadly speaking, we do have a very supportive ICS in terms of individuals who believe in the sector and know that we can add a lot of value. And we're lucky in that respect, because having engaged and met with colleagues in other ICS areas, there are some ICSs where they don't have that, where they have colleagues who really don't see the point and kind of aren't on board with getting the sector involved. So that's one thing that's really good that we do have. And this is just a bit more detail about kind of the early thinking of HIVCA. So there had been conversations, and then the pandemic happened. And obviously that brought about a huge amount of collaborative working. And I think the pandemic also, showed the real value that the VCSE sector could have in health and care. And so we started this path towards HIVCA with funding from NHS England, which we were vaguely calling some sort of VCSE alliance or engaging group. I've got my slides in the wrong order, and this is what's happened so far. So about a year ago, we set some objectives. We had a workshop. Why are we doing this? We clarified what the sector would get out of being involved in the integrated care system, what we wanted to achieve. We have had a few different information sessions. The first one was in January, and there's a recording of that, which largely goes to the information I've just gone through. If anyone's joining now at 1 o'clock, if you're keen to have to hear a bit more about kind of the history of the integrated care system and how it started, we can share a link to that recording. Then through the spring, we put together a number of task and finish groups. So there was an open invitation for organizations to get involved, and we had about 30 organizations join 4 task and finish groups and work through some of the details of what does putting together a VCSE alliance actually look like? What does that mean in terms of the governance structure we'd use and the resourcing we need and the positioning we should have and all of those things. We also had a values workshop starting to explore with some other ICS colleagues from local authorities and the NHS, what the value of working with the sector would be and what our shared values are in terms of, again, thinking about what we're trying to achieve. And then since the spring, over the summer, we've been working on developing the plan that the task and finish groups came up with into a business case that the ICS now needs to fund. So that's kind of where we got into so far. And I'm going to come back to that where we are now a little bit at the end of the session. So the next part of the information session today is going to be all about, so what is HIVCA? And the first few slides talk about our vision, mission, values. These have come from those workshops that we had at the last year and during the spring, and the task and finish groups. So this is currently how HIVCA is articulated. So HIVCA, as you'll see from the logo on the right, is the Hampshire and Isle of Wight VCSE Health and Care Alliance. We didn't put all the words, all the letters in the acronym because it's harder to pronounce that way. We've just used a few of them, but HIVCA for short, and we have a bit of a brand for HIVCA now, so we can start distinguishing it and letting people know what it is. So HIVCA's vision, as on the slide, our vision is that the people of Hampshire and Isle of Wight can live healthy, active, independent lives full of connection and contribution within their communities for as long as possible, and that health and social care support is well integrated into people's lives to support the best recovery and care. So that's our vision as HIVCA. Then our mission, what our role is in order to achieve that vision. Well, we will play an active role in the ICS and bring our collective specialist expertise to focus on prevention and early action, as well as lasting impact, to create social value that tackles inequalities that impact on health in our communities, to provide a direct link to communities and their experience of health needs so that solutions are built around them, and to demonstrate the value of collaboration and working across and beyond organizational boundaries to bring change. So that's the mission of HIVCA. And these are our values. There's 5 of them. There's 2 on the next slide. So the values are we're inclusive. So we include voices and experience from across our communities. We're strategic. We're going to move beyond transactional service delivery and bring a strategic voice to the integrated care system. We are community-led, advocating for community needs. We are asset-based, recognizing the whole lives of the people in the communities that we work with. And that we work based on trust, honesty, trust, and trusting information, and holding each other accountable. So this is going to be, or is, HIVCA's governance structure, okay? I'll come back to this a bit later, but what we're going to do now is going through each of the elements of HIVCA. In the center, that's all of HIVCA's members, that's the assembly. HIVCA's assembly is supported by a number of different representation roles, including place representatives, thematic representatives, and a leadership committee. We also then have secretariat roles, which help to support the functioning of HIVCA. And the rest of the session really is talking through each of those, because these are all the ways that your organizations can get involved in HIVCA as an alliance of organizations. So the HIVCA Assembly, that's all the VCSE organizations working across Hampshire, Isle of Wight, Portsmouth, and Southampton, who have an interest in health and care, who want to be a member, and who agree to uphold the vision, mission, and values of HIVCA that I've just shared. So that's all that's required to be part of HIVCA. And being part of the HIVCA Assembly gives you opportunities to put yourself forward for leadership and thematic representation roles, the opportunity to represent HIVCA where you have expertise that's relevant, that HIVCA is being called on to provide, to share your opinions and to vote on decisions about HIVCA going forward, and to participate in HIVCA-wide events that will be organized once HIVCA is really up and fully resourced and functioning. So as I move on, we're going to, because I thought about putting links in the slides, but you can actually click on them as I'm going through. So we will provide links by email to all of these things. Although if you go on our website, on Action Hampshire's website, there's links there as well, but I will send them out. To join HIVCA, there is a form that you need to fill out. Now, please do only fill this out once. I have noticed we have a couple of, every time we send it out, I think we have a couple of organizations who have signed up more than once. So you only need to sign up to HIVCA once, and then we have your details, and the application just asks you to confirm that you're happy to uphold those vision, mission, and values, and asks for a few details about your organization in terms of, are there particular places or thematic issues, community groups that you're most that you support, so have more relevance for you, and those sorts of things. And they ask you to nominate a kind of representative person that we can liaise with. And going forward, once HIVCA is set up and funded, there'll be a newsletter for HIVCA members that everyone will be invited to join and so forth. But for now, we've got a form to fill out and register your interest to join the assembly. The rest of the elements, so the assembly is for everyone. The other elements are done on the kind of basis of representation. And representation has come up a lot in the development of HIVCA, and it's something that people, feel quite differently about. And there's lots of good and bad experiences across our sector of representation. So what HIVCA has tried to do is put together a model for representation that tries to address some of the concerns and bring out the best in terms of what representation is going to look like for HIVCA. So just before we go into the specific roles and what they look like, these are some of the kind of principles about representation within HIVCA, just to highlight. The first thing is that there's going to be a transparent process. So it's going to be clear, as I'm going to outline now for what we know so far, how organizations, individuals will put themselves forward to be representative, how those decisions get made, at what sort of point they get reviewed, for how long. There's going to be a principle of rotation, whereby if somebody gets selected as a representative of this theme or this place, there's a kind of time limit on that, and there's an opportunity for others to put themselves forward at some point. So we have a rotation of different views, because the whole point of this is that our strength is in our diversity. The next principle is that time for representatives is compensated through HIVCA funding. So at the moment, I can't think of one. If you know of any, put something in the chat, but I don't know of any representative roles that we have, whether it's through the Hampshire Leadership Forum or the Isle of Wight Voluntary Sector Forum or the one in Southampton, anything that we as a sector put forward when we nominate representatives for something, generally that's on an unpaid basis, or essentially the organizations who offer to be representatives offer basically to do that at no additional cost. And the challenge with that, not to suggest anyone who's a current representative somewhere isn't doing that in the best way possible, but the problem with not compensating representation time is that, well, there's lots of problems. It puts a strain on the individuals who can come forward. It means that only some organizations can afford to do that if they happen to have the funding to cover that time from somewhere. And it also means that ultimately the accountability that that person has is to their organization who's paying for their time, not necessarily to the wider sector they're supposed to be representing. So the idea with HIVCA is that the majority of the budget we've put forward is to compensate representatives. And that's because we can then have a system of accountability whereby if you're representing HIVCA, then you're agreeing to be the best representative you can be. And there are accountability mechanisms built into that. And it's almost like, performing a contract then. You're contracted by HIVCA to carry out the representation role. The other point around there is around training. What does it look like to be a good representative? We're going to have a system of support by having the Secretariat roles to support reps. So they'll have support, admin support, coordination support, and also training to make sure that they understand what being a representative means, things like conflict of interest and accountability, and what that role really entails. Accountability, I've talked about a bit there, and there's a last one that I forgot to put on the slide, which is important. Another principle is that representation should never be one person. We should never have one person at all being on the shoulders of one person, because we're all human. There are times we can't show up to something, and then what do? We don't have anyone in the room. There's over 10,000 VCSE organizations in our sector. Not all of them will want to become members of HIVCA, but there's certainly enough of us to go around that we don't have to put representation on the shoulders of one organization ever. So the principle of representation is that we share the load. So on that basis, these are the types of representative roles that we have in HIVCA. There we go. So we have representatives of places. So those 4 places are Hampshire, Isle of Wight, Portsmouth, and Southampton. And their role is to bring place level issues into those system-wide discussions. So this isn't about funding individuals to get involved in place level initiatives, because we already, presumably there's existing funding and resource and systems for that already. That's one of the things we already have. But what we don't have is funding for those individuals to come together and take part in strategic system-wide discussions representing their place. That's what, for example, the local authorities are doing when they come together in the ICB. You have representatives from the different local authorities. And so this is HIVCA's version of that. And so how this is going to be managed is there's going to be 2 representatives, place representatives per place. And broadly speaking, that's going to be 1 CVS, which is a term that stands for Council for Voluntary Service. If you're not familiar with that term, that means organizations like Action Hampshire. So organizations who our mission is to support the sector and to coordinate and to convene the sector in other ways. And so, for example, Action Hampshire, and then on the Isle of Wight, we have Community Action Isle of Wight, and they provide support to the Isle of Wight Voluntary Sector Forum. So for the Isle of Wight, for example, you'd have a representative from the CVS, the Community Action Isle of Wight, and then you'd also have the opportunity for that existing place level forum to nominate who their representative is going to be. And then again, that will be on the basis of rotation and on compensation and all of the other principles. So that's the place level representatives. Then we're going to have thematic representatives, and this is the model that colleagues who were part of the Task and Finish group this spring came up with. This is largely based, as I mentioned, on the Northeast North Cumbria model, where they have a similar kind of setup of thematic representatives. The themes that have been selected are largely population group based. Originally, we had a longer list of themes that also included certain health conditions and so on, but with limited resource, we thought as a starting point, we're going to put forward 10 thematic representatives, and we've chosen, or HIVCA so far has chosen 8 of them. So there are the possibility that that we can identify 2 other ones, which is one of the things that we're kind of asking about in the HIVCA Assembly sign-up form. We ask sort of what population groups you particularly support, and depending on what comes back from that, we might add additional thematic representatives there. Like the place representatives, there's going to be 2 reps per theme, and this is going to be structured so that there is an opportunity for 1 larger organization and 1 smaller organization to be a representative per theme, so that it's not just the biggest organizations who come forward. And these representatives are going to take part in system-wide discussions. Sometimes those things will be, if there's some sort of gathering focused on mental health, sometimes it'll be going along to that. Sometimes it'll be being the mental health kind of perspective on a general sort of issue. So bringing that specific specialist understanding of those communities or those themes. Being a thematic representative also means being a point of contact for other people who have relevant experience and interest in that theme amongst the assembly. And HIVCA will have things like an online discussion forum and newsletter groupings and quarterly meetings for the different thematic groups, so that there's a way in, a point of contact. And the point of this is to link up with existing touch points. So again, there are, especially looking at some of the themes, not all of them, but some of them, especially around children and young people and older people, mental health and so on, there are existing groups where organizations are already getting together. So it's not about reinventing the wheel and duplicating things, but it's about making a link, because it's not often that those groupings are for the entire system-wide patch. So this is kind of being able to tap into the different touch points we already have and be a point of contact, both to share out information and also to hear the voices of all the organizations focused on that theme, to then be able to raise that up to the leadership committee and to other parts of the ICS. So just going back, I thought I'd put it in just again, just in case we've lost where we are. We have the assembly in the middle, we have place representatives, we have thematic representatives. There's two more parts, and then it'll be over to you for questions. Oh, sorry, I forgot one little bit. There will sometimes be ad hoc representative roles. So we've put in the funding proposal, business plan, a pot of money that we can use to be, that's less structured. So one particular need that we've identified at the moment is to have representatives from HIVCA who can help us select the leadership committee and the secretariat roles, because we don't yet have, going forward, the leadership committee will be able to put in motion processes to elect from the whole membership of HIVCA, but it's going to take some time to get the word out about what HIVCA is and how organizations can get involved. And we don't yet have the resource to set up a kind of, entire voting process for 10,000 organizations to pick who's going to get to be the leadership representative. So in the absence of that, we're looking for organizations who have someone in their team who has a really good knack for choosing the right candidate in interviews, or who has a lot of understanding about what good representation looks like and can spot a good rep, to come forward and help us out on the selection committee. So that's the immediate kind of need. And then going forward, there'll be times when somebody from the integrated care system will come to HIVCA and say, we really want a VCSE perspective about, it could be a particular medical issue, or it could be a particular neighborhood. It could be anything in between. And so we have a pot of funds so that if you're asked to represent the voice of HIVCA beyond the voice of just your organization, then we'll be able to cover the cost of that representative time as well. Leadership committee is the next one to come on to. So the structure that's been designed by the Task and Finish group is for an 11-person leadership committee, which includes a chair and a deputy chair. The leadership committee will have representation secured on the integrated care partnership. We are hoping to convince them on the integrated care board. They will come together and be able to consider the trends, the evidence, the positioning, and be a strategic voice for the sector. If we are asked for a HIVCA position on something or to send a representative, the leadership committee will be the go-to. So it will be more of a time commitment. And I'm regretting now not putting the time commitments for the estimated time commitments for these roles on the slides. I will send that out by email if we do have it in a document, but I forgot to pop that on the slides. The leadership is ultimately representing the HIVCA Assembly, so that's who they're accountable to, and there will be a kind of rotating element to the leadership committee, as there will be with all the representative roles. Finally, the last element to mention is the HIVCA Secretariat. So we're going to have two fully funded roles that will be working for HIVCA. One of those is a partnership and engagement manager, and that person is really about relationship building relationships with all of you and building relationships with people in the ICS. So I've been kind of filling in for this role, basically, but it's time that we got actually a full-time person who can really do it and spread the word and make those relationships. And so that's what that role will be about. Then we're also going to have a coordinator or administrator kind of role, and that person is about, you know, somehow figuring out how to corral 10,000 organizations that we have in our sector into these different groupings. So they'll be putting together the quarterly thematic events and the voting systems when it comes down to nominating people and organizing the training for the reps and everything in between. So that's the idea for those two roles. We'll also have dedicated funding for comms support for HIVCA to continue to raise awareness about HIVCA so that more and more VCSE organizations come on board, and so that more and more other people and parts of the integrated care system become aware of HIVCA and how we can work together. And also so that, you know, the leadership committee can say, you know, we want to do an information campaign about this issue that the sector is brought to our attention, and we have the support to do that. And then we have also proposed, and this role is, you know, it's kind of up to the NHS to take it forward, but we have proposed that we need an ongoing champion of the VCSE sector. We have that temporarily in someone called Tim Cooling, whose title is something like Strategic Partnerships Lead, who's been the main point of contact for us as we develop HIVCA. But at some point when those partnerships are set up, I suspect that Tim's role will move on to other things. And so we need to make sure that ongoing we have a VCSE champion who has at least 50% of their time to dedicate to making HIVCA's, you know, embedding in the governance and decision-making structures, making that a success. So that's what we've asked for going forward. The Secretariat roles are hosted within the sector. That's what was agreed or proposed by the Task and Finish group. And as the kind of holder, convener of this so far, those individuals would be employees at Action New Hampshire, and we would provide the kind of management of the basics of that kind of thing. The recruitment isn't going to be like a normal Action New Hampshire recruitment. It's going to be with the selection committee in mind, with NHS colleagues having a role in it as well. And the reality is that it's likely that the Secretariat capacity will change and grow over time. You know, we talked about using the Northeast and North Cumbria model as a kind of similar sort of patch to us. They started with 2 staff roles, and 2 years on, they now have 6, because having HIVCA has attracted new projects and models. And so they've been able to kind of expand that, and they have dedicated, you know, coordinated project staff. So it could be that there's more representative roles, more staff roles over time. This is kind of the point where we're starting from. We have started recruitment for both of these roles, and I'll send the links out along with all the other links in case you happen to know anyone. There have been a couple of delays in terms of securing HIVCA's funding, which I'll come on to at the end, which do mean that the timeline of those have changed a bit, but we are still openly recruiting. The roles close around mid-November, and so that is kind of ongoing. So I do have some slides at the end in terms of next steps and the business plan and a summary of ways you can get involved, but I'm going to pause now, slightly ahead of schedule, thankfully, and see if you have any particular questions. I've rambled on about all the bits of HIVCA I think might be interesting to you, but likely there are specific things that you want to know. So I'm going to briefly stop my share so that I can actually see you all. And over to you. I'll even try turning the light back on in my little phone box, and it'll last for a while until it starts flickering again. So any questions about HIVCA? Don't all speak at once.
There's a couple of questions in the chat as well, Leah.
Okay, great. I'll go to Natalie, who has her hand up. Go ahead.
Hi there. Hi, thanks, Leah. So just so everybody knows, I'm Natalie, Chief Exec at No Limits, which helps children and young people. Just a question about the thematic I can't remember what they're called, thematic leads. I can't remember the language. Have they been, so I'd be really interested, for example, from a children, young people's perspective, are those thematic leads in place yet? Sorry if I missed that bit, I was slightly late joining. Are they in place? And if not, what's the process there?
Great question. So none of the representatives are in place at the moment. We have so far opened recruitment for the selection committee and the staff roles. We have, the next one will open is the leadership committee, and we will open that as soon as I have some sense of, oh, the light's going again, some sense of that the funding is definitely kind of coming down the line, so that we can recruit those people on the basis that we've said, which is that representatives should be paid for their time. But that will start fairly soon. And then the thematic groups will take a bit more coordination, because the intent is for, rather than just generically for them to be selected, for the organizations that have an interest in those themes to be the ones that kind of, you know, decide that. And so those elections will happen once we have the staff roles in place to be able to coordinate that, but just logistically it's going to take a bit of doing. So that will come, you know, timing wise, probably more like January, in terms of you know, putting together a thematic group for, you know, all the young people's organizations to say, okay, I want to be in that group, and then there'll be a process for that group to put themselves forward, and then a kind of election process, so that people can vote for them. So that's kind of roughly the anticipated timelines. But yeah, we don't have any representatives in place yet, so it's still early days, lots of opportunities for everyone to get involved.
Thank you.
I'm just going through the questions that are in the chat. The first one I see is there a list of HIVCA members? Technically, yes. It's not one that anyone else can see, because we've asked for things like people's emails and names and things, which I can't just publicly share because of GDPR and all of that. But what we will do is, once HIVCA is fully staffed, it will have its own, you know, website and online space, and then there'll be a public place where everyone can see who, you know, who is a member of HIVCA and who the representatives are and all of that. So at the moment there is a public list, but yeah, I mean, if you filled out the form, you'll recognize the form, and just don't fill it out twice. There's a comment from, or a question from Kay about which two we need, and because I don't know at which point you asked that, I don't actually know which.
So rightly, you were talking about the condition specific, or the subject specific representatives, for example, neurodiversity and those kind of things, and you said you'd got the 10 of them, but you needed another 2, and I just wondered which 2 areas, because we might then have areas that we could recommend, or people we could recommend in.
Fair enough. Yes. So what I meant by we have the 8 out of 10 is that we know what the thematic category, you know, the thematic groups will be. So not that we have the people yet.
Okay, got it. Yeah.
That's not happened yet, but we have a space technically for 2 other themes. So if looking at that list, you think there are other themes that HIVCA definitely should have representation from, then that's what else we can add in. And I think actually the next comment after your one might be somebody suggesting that. I think Sarah.
Yeah, I think it is, yeah.
That potentially people on a low income could be a thematic group. And I think that makes a lot of sense, although I do think that most of organizations are now supporting people on a low income because of the cost of living crisis, aren't they? So I'll pause from the chat ones and go to Julie, who's got her hand up, and then I'll come back to the chat questions after that. Go ahead, Julie.
Thank you, Leah. It's just a question. So obviously you've had a working group looking at this, but the different audiences that have been identified, have they been led by the priorities of the health system, the ICS, or have they come from the voluntary sector itself? How did we identify those groups? And therefore I'm thinking about also about the 2 other groups that we've not got a conclusion on.
Yeah, so those were identified by the task and finish groups. Initially there was a small group of 5 or 6 organizations, and then the task and finish groups came together, and also with a few other people in May, I think, and kind of looked at those, and that's where we ended up with the list. As I say, originally it was much longer. It had lots of different kind of health, we had cancer and reproductive health and those sort of health-based ones, but then looking at costing that out, the budget was just looking impossible if we did that. There was also a number of things on the list where actually we don't have many organizations dedicated focus to that issue enough to kind of, because the idea of the thematic groups is that there's enough that, there's not just one organization who would be the only one who could really speak to that issue, that there's many that would come together. So that's kind of how we've ended up with the list so far. And I say it is an initial list, and I think the intention is that to show the value of that for the larger issues, and then be able to scale up and add additional ones as needed. It could also be that some of the ones we've identified actually, the model doesn't quite work. There's nothing really for them to fit into, and so we kind of move things around. So that's the sort of review that the leadership committee will look at on a kind of annual basis. There was also a question about will you be notified? So the best way to be notified about everything happening with HIVCA is make sure that you're signed up to the assembly, because going forward, that will be the main point of contact. The idea being that only assembly members can put themselves forward to be a representative, because you have to at least have joined the assembly. So that's the first point of call. We don't have a mailing list and things set up yet, but what we'll do is use that list of people who've signed up as the de facto mailing list to let people know. And for now, we're also still, sharing information on the Action Hampshire website, and we try and get all the other CVSs to share it out and so on. So if you found out about this event, you're probably plugged in somewhere where you will hear about when we've opened the calls for things. So hopefully you won't miss out on that, but definitely the best thing to do is to sign up to the assembly list, and then you'll definitely hear things. Helen, you've got your hand up. Hello.
Hello, I am just trying to give you my video. It's not, there we go, sorry about that. So just going back to the thematic representatives and those 2 spaces that are available, and looking at, so we represent people with dementia, which obviously covers older and also slightly younger people, so it's feeling like it kind of doesn't fit anywhere. I'm wondering whether long-term health could be one of the thematic themes, but then is there an opportunity then longer term, I know it's not going to happen immediately, but then to have sub themes within the themes so that different people can represent different groups within that theme, to try and bring it all together?
Yeah, great. No, I've noted that down. I think the sub themes is a really interesting one. It's the sort of thing that each of the themes, when they come together, will make sense of it as they do. And there might be some that are more obvious than others, and that divide into different kind of sub themes. But I think that makes a lot of sense. And the ideas that we've had to support those things, like online communities and that sort of thing, will lend themselves nicely to kind of subgroups, because yeah, it is hard. And the reality of focusing on kind of population groups is that some organizations will find themselves wanting to be involved in several themes, which is why there's other elements and ways to get involved as well as the themes. We'd have to divide it in some way, and so it seems like population groups might be the best way. We did have longer term health conditions on the long list of all, when we did a kind of big brainstorm of all the things, but then like many of the other health-based kind of ones, we thought, well, actually, well, this is too long. So if we focus on population groups and being able to represent those issues, it might that might be the best way to kind of start. But definitely, I think there are lots of organizations that do focus on longer term health conditions. So it's just a matter of how we best kind of group them together.
Brilliant, thank you. Also, I don't know if anyone's heard a newsflash, Truss has resigned.
Goodness, interesting.
So we have a new PM in a week, apparently. Here we go again.
Well, we'll all remember where we were on the momentous occasion.
Leah, didn't you just say you'd got some jobs going? Maybe we should send you the details.
I say, how's the lettuce doing? Has anyone seen there's somebody who's been filming a lettuce to see if it would last longer than.
It's the Daily Star, and they
Yeah.
gave it some tofu yesterday, apparently.
Oh goodness.
Maybe you're looking for people to fill that slot though, who've got can demonstrate successful previous experience.
True, yes, with the roles. Well, if you have any opinions about what we should be looking for in those roles, then maybe you're a candidate to join the selection committee. I can't go on about that enough, mostly because the deadline has passed and we didn't have many applicants. So if you have anyone who either thinking about hiring staff or appointing representatives would be interested in helping out, then please do. All of the time that someone spends on it would be compensated, and it's a fairly minor commitment, unlike the leadership committee, which will involve, and the representative roles, which will more require kind of ongoing monthly commitment. But are there any other questions before I go into? Oh yeah, over to Natalie.
Oh, I was just going to say, with your recruitment, your recruitment of people to help you with recruitment, I feel your pain, because probably, I don't know about other people on the call, but I think recruitment is a problem for everybody at the moment, isn't it? So recruiters are hard to come by, and if you've got a good one, they're overworked, probably. So I feel your pain with that one. So it's not a very helpful comment, but good luck.
Thanks, Natalie. Not volunteering then.
No, I'm sorry.
So with the handout.
I would love to, because we actually have an awesome person who leads on our recruitment, but their capacity is so overstretched with internal recruitment, because recruitment is such a tough thing at the moment. So sorry.
Fair enough. Well, keep spreading the word for us, and that kind of moves me into, I'll go and do my final slides, and then if someone has, if you come up with a question, we can come back to that, because we still have 15 minutes or so. So I'll just go back into the screen sharing. Hopefully that's working now. If you will let me move on. Okay, so I mentioned all the good stuff about we do have a supportive ICS, and we have the support of NHS England, and we've been working on this for a year, and the sectors come together and all the good stuff. There have been challenges, and these are the current challenges. It is an ongoing challenge to articulate the added value of HIVCA. Within the integrated care system, some of the people who I've talked to about HIVCA come back with, but we already get volunteers from this organization, or we already commissioned this volunteer organization, or we already have somebody sitting on X board. So we already do that, so tick. And so articulating that's not what HIVCA is about. It's about the strategic involvement, being involved in governance, coming together as a whole system, not just a delivery partner. It is an ongoing challenge to articulate. So it's one I'd like to kind of share with you, both to see if you have any thoughts about, particularly compelling arguments or examples where you would like to share. Please do let me know. And as you go about your any involvement that you already have at those kind of delivery level points or representative points, please do kind of champion the cause of HIVCA and the importance of us getting involved in strategic decision making. Say, well, this could all have been avoided if you just kind of involved us in the strategic planning, and hopefully if we all start kind of ringing the bell for that, the message will spread. The other challenge has been around securing the funding for HIVCA. So there was a small amount of money provided by NHS England, which has covered some of my time and also the representative time of all of the organisations who took part in the task and finish groups and the other workshops that we had earlier this year. That funding has run out. It ran out at the end of September. And so since then, we've been kind of self-funding on a wing and a prayer, hoping that the budget for HIVCA gets approved. The challenge is that the ICS has been formed by bringing together, the existing CCGs and all the previous structures. And what they've done as a first point is to plug all the things we had before into the things we have now. And that's pretty much filled the budget. And so the challenge is that for the NHS colleagues, they're going, well, this is a new thing. Where does it fit? Because it didn't have a previous budget line before, and it's a new thing, and it takes time. It's something that the people who are championing it for us believe in, but it's not necessarily something that's easy for them to just kind of find the funding for. So it's taken a bit longer than I had hoped, but it does feel like we are moving forward, and we've got a good plan to kind of figure that out. The good things that we also have is that we've been able to, because this is happening in all the different ICS areas, we've been able to get comparison information about a bunch of those. And broadly speaking, the level of funding that we're looking for HIVCA, which is just under £400,000 a year, the majority of that being for representative roles, is comparable to other ICS areas roughly our size. It's not the most expensive request, certainly. One of the ICS areas, it's either Yorkshire or Lincolnshire, somewhere north like that, has got £1 million for their alliance. So we're not the most expensive one. And there are other areas which, with a much smaller geographical patch like Cambridgeshire, who've just secured 400,000 there, and they have a much smaller and less complex geography than we do. So it's an entirely reasonable request that I am banging the drum for, but it's not been the easiest path. And unfortunately, we thought we were pretty much ready to go and that we had the funds in coming along, which is why we moved ahead with the recruitment. And that's just, there's been a bit of delay to that, but I do think it will turn around. So all that to say, it does mean that currently there is no, Action New Hampshire doesn't have current funding to technically, my time sharing this with you now is not currently funded. And so that does mean I need to ask for your patience. I think some of you who I've invited along to the call or who might be hopefully watching the recording at some point have written to say, could we please have a one-to-one and can you tell me all about how I can get involved in HIVCA? And we just don't have funding for anyone to technically do that at the moment. So I'm trying to fit in what I can, but holding things like this or referring people onto the recording is why we have to do some of that. So just ask for your kind of ongoing patience with that. What's next, what's coming up is that we are revising this business case. We're putting in a bit more of those, which arguments will be most compelling to the people who have the sign-off authority about budgets and building those ICS relationships. We're going to have a bit of a kind of roadshow through the different ICS partners, the hospital trust and the mental health trusts and so on, to get them all on board with HIVCA over November. And then I expect that the funding will be agreed somewhere between December and January. That's my current expectation. And we'll be looking at an 18-month startup period, whereby we will deliver a kind of list of startup tasks and focus on getting the relationships in place and getting a signed agreement and building all the relationships and demonstrating what HIVCA can do. This is a recap of ways you can get involved. So if on the basis of this you feel like you want to contribute to the business case, you have some really compelling thoughts, you have an hour or two of time that I can't afford to fund at this point, but you want to help out, please get in touch and let me know, and you can review the business case and help add in the bits that we need to add in to get this funded. Join the assembly. Add your details only once, please. You can apply to be part of the selection committee, the leadership committee, and the thematic groups, and then representative roles once those all open up. And spread the word. I mean, one of the biggest challenges we have really is getting this out across the sector. There are, thousands and thousands of organizations, many of whom are very small, don't have a huge amount of time to engage, but actually, really could add significant value. So please, spread the word and advocate for the HIVCA approach. Talk about why it's important to have a transparent, coordinated level of VCSE strategic representation in the system and in other areas too. I'm hoping that this model of representation for HIVCA can then be leaned on in other places where we're asked to represent in a sector, and we can say, well, if it's done in HIVCA, we can get it done elsewhere. But just spread the word and be part of it. So I'll stop there and go back to you and see if you have any more questions. There was a couple more comments. The funding is from the integrated care system. That's where we're expecting to fund it, largely because in all the other ICS areas, that's the expectation really, is that they have to embed us and they have to fund it. That's kind of the message that's come from NHS England. Unfortunately, there haven't been a huge amount of details in terms of, there's no like, you have to fund it at this level, or this is how, this is where the funding would come from. But that's what we're looking at for now. But then the hope is that once we have HIVCA all together, that's the starting point. That's to fund the startup of HIVCA. And so together, as an alliance, as an integrated care system, we're then in a position to seek funding from other sources together. So I think the initial startup costs, we're looking at the ICS to fund that. And that then there's potential, some of those roles that I mentioned in the Northeast North Cumbria, one where they've gone from 2 roles to 6, some of those have come about from applying for joint funding on, as part of the integrated care system from other sources. So I think that initial startup funding unlocks the potential to work together once there's the capacity there. It's helpful to know about how the Yorkshire Alliance has worked there. And I will follow up with Natalie about the business case one-on-one. That's probably the easiest thing. I'll put my email in the chat. I think most of you have it, but just in case, feel free to reach out, and I'll do my best to get back to you. Any final questions before we wrap up? Okay, well, thanks so much, everyone, for coming along and listening to me ramble at you for an hour and a bit. I will share the recording. I know some people joined a bit late, and there'll be people watching this recording at some point. Apologies, I missed out the first few minutes, but that is just covering the stuff that we covered in the January webinar, so you can always watch that again. Thanks again, and I'll share all those links that I mentioned and the recording for everyone who registered to attend the event, and hope to see you all at future HIVCA meetings going forward. Thanks again. Bye.